This is Dr. Corey Maas on Looking Your Best. I wanted to talk today because it's an exciting area about chin or neck fat and hanging and the options that are available, including chin or neck liposuction, which is not new. It's certainly a procedure that's been around for many years and one that is very much different than body liposuction, where large volumes of tumescent or local anesthesia fluid are injected. We're talking liters of fluid, and where a lot of blood and fluid are expected to be lost and people have significant recoveries. Body liposuction is a very different experience than under the chin lipo or neck lipo, or the chin, the point, we call it the mentum, submental liposuction. So those are terms for it. Submental liposuction is a procedure that can be done in less than an hour in an outpatient setting. It can be done with local anesthesia only or with some light sedation. The only part of submental or chin liposuction that stings is the local anesthesia portion, which is done in just a few minutes. And most people choose to have a little medicine, even if it's oral sedation, just for that part of the procedure. Once that part, the local anesthesia, is done, the patient you feel no discomfort for this. So if you don't have a nice sharp neck angle, irrespective really of age, this is a procedure that most people will consider. The other differences between this and body lipo are there are very small cannulas, 2 or 3 millimeter in diameter. These are very tiny cannulas that are used to create a series of little tunnels by evacuating the fat under the neck. The beauty of the procedure is that we can put that cannula directed along the jawline to reestablish a jawline. We can bring it down as low as we need if we have little fat rolls in the lower part of the neck, and we can make sure that we're leaving a nice, even, very thin layer of fat, which is a cushion and a way of making the skin very smooth. We don't want to take too much of the fat and then have the dermis sticking to the underlying muscle, the skin sticking to muscle, not good, but a nice thin layer of fat that is uniform and provides an excellent angle between the chin or the cervical area and the neck. This angle we'd like to see right around 90 degrees in everyone. And this is mostly genetic, by the way. So when you gain weight or lose weight, your neck doesn't change very much. Your face will change. Your face will get fatter and thinner when you lose weight. Your waist will change, your hips or thighs or your buttock area. Those areas where you gain or lose weight are pretty common. They're unique to individuals, but those are the zones that change. So if you have a neck that's hanging, you have extra fat there, that's not going to change very much when you gain or lose weight. And so this genetic phenomenon of having a hanging neck outside of the issue of very loose skin is treatable with submental or chin liposuction, and is something that should be in everyone's consideration. In today's world, there's a lot of excitement because there are drugs like Kybella or deoxycholate, which you can inject into the skin or below the skin in the area of the neck in carefully marked zones, and with properly trained physicians, and we do the trainings here for a number of doctors, and you can get over time a nice contour of the neck without having to do the submental liposuction. And there's some advantages to that and disadvantages we've talked about in other videos, but the long and short of it is Kybella will destroy the fat by breaking the fat cell open. The debris or remnants of those fat cells, however, are still there, and it takes a while for the body's inflammatory process to clear them. When you're doing submental or under the chin liposuction, you're evacuating the fat, and all of those extra parts of the things that are not being used are gone with the fat. So there's really very little swelling typically with this and very little recovery time, in contrast to treatments like Kybella or the other option, which is cool sculpting. Cool sculpting, the cool mini device fits on the neck nicely, freezes the fat, destroys the cells, and is another alternative that's completely non-invasive. No injection, no wound. You have a hickey, you have swelling, that's going to be common. And in fact, those two things, Kybella and cool sculpting, have, in our experience, a longer recovery time than most people doing under the neck, under the chin, submental, we call this, liposuction. So there are very good questions about how we do this, and is it an alternative to neck lift, and what if you have platysmal bands, which are the cords that hang in the neck. Now these are special concerns or considerations that we always think of when we're going to contour the neck, but under the chin lipo or the neck liposuction is a procedure that takes about an hour, that is post-operatively painless, that has very little bruising when it's done correctly, at least in our hands, very little bruising associated with it, and has a very quick recovery. And the other alternatives, which are more minimally invasive, are Kybella or Cool Sculpting. So we have lots of options now, and they're all excellent. The post-operative recovery is quite simple. There are usually 1 or 2 stitches under the chin and one behind each earlobe that you can't even see afterward. They're really well hidden. We use flesh-colored sutures. They come out after a few days. There's a little soreness, but certainly nothing that people require narcotic pain medicine for. If they want it, they can have it, but it really isn't necessary in most people. And really the effect is there right away. In all of these technologies, we encourage people wear a little elastic head strap. So in summary, there are great options now, including chin or neck liposuction, depending on how you define it. We call it submental liposuction. That's the mentum. It's been around for a long time and is still a great option. But with Kybella or deoxycholate around, and with Cool Sculpting around, there are really, really good alternatives to doing even the minimal surgery that's out there. If you have any other questions about submental or neck, chin liposuction, please don't hesitate to write or call me. We have taken a lot of questions in recent days about this, and I just think it's really important people know their options. Sometimes it's not an easy decision because all 3 of them are great options. This is Dr. Corey Maas on Looking Your Best.